Goni Thoracic and Lumbar Extension. Position the patient in standing with the cervical, thoracic, and lumbar spine in 0 degrees of lateral flexion and rotation. In patient-appropriate language, ask the patient to extend the trunk as far as possible. Palpate the pelvis for posterior tilting. Passive movement is generally not assessed due to the difficulty in moving the patient through full range of motion of spine. The end of thoracic and lumbar extension range of motion occurs when resistance to additional extension is felt by the patient and the examiner feels the pelvis start to tilt posteriorly. The normal end feel of the joint is firm because of tension in the facet joint capsules, the anterior fibers of the annulus pulposus, and the anterior longitudinal ligament. Passive tension of the rectus abdominis and external and internal oblique abdominals. The end feel may also be hard to contact by the spinous processes. You are now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. For this measurement, you will be using a flexible tape measure to record measurements. Use a skin marking pencil to mark the spinous processes of C7 and S1. Recall the technique taught in class to find C7 and S1. Align the tape measure between the two processes and note the distance. Hold the tape measure in place as the subject performs extension range of motion as done previously. Allow the tape measure to accommodate the motion. Observe for any extraneous movements of the pelvis. Record the distance at the end of the range of motion. The difference between the first and second measurements indicates the amount of thoracic and lumbar extension. Make a note of the difference measured. Measure twice. If the measurements are off by greater than 2 centimeters, take a third measurement. Take the average of the measurements and document it in the patient's chart. If necessary, assist the patient to the standing position. Average range of motion is 2 to 3 centimeters.